Hi there. Please keep in mind this podcast is for informational and educational purposes only. The information and education provided are not intended or implied to supplement or replace professional medical treatment, advice, and/or diagnosis. Hi, welcome back to my podcast. I'm Ashley, a registered dietitian nutritionist, and I'm here to talk about nutrition hot topics, particularly for my ladies, as it relates to how we can optimize our diet and lifestyle to manage various health conditions. Today, I want to talk about uterine fibroids. Particularly, I want to talk about exploring the connection between uterine fibroids and vitamin D deficiency. Why do I want to explore this topic? And why is it such a hot topic these days? Well, there's emerging research that suggests that there's a link between vitamin D deficiency and fibroid growth. And we know that fibroids particularly affect women of color, Black women specifically, often have fibroids. And so we want to look at what is driving this and what can we do, especially from a nutritional standpoint, to manage this condition. So first, let's start off with an overview. What are fibroids? Uterine fibroids are non-cancerous growths of the uterus, and they're common in women of reproductive age. And again, we also tend to see them in Black women. Symptoms include heavy menstrual bleeding, pelvic pain, and in some cases, infertility. Vitamin D is a fat-soluble vitamin that's crucial for bone health, immune function, and cellular growth regulation. So some sources of vitamin D can either come naturally from our environment or through food. The most predominant source of vitamin D is going to be sunlight. So that's how humans, we all get our vitamin D primarily from exposure to sunlight. But there are certain foods that contain traces of vitamin D, and that includes fatty fish, especially if you're eating the skin of the fish, as well as fortified milk and some supplements. You can get vitamin D supplements to help boost your vitamin D levels. Like I said, there is research that suggests that there's a connection between vitamin D deficiency and fibroid growth. And so I think it's important to understand what are the causes of vitamin D deficiency and why perhaps we might see a link with uterine fibroids. So in terms of causes of vitamin D deficiency, we know that limited sun exposure is going to be the main cause because, as I stated previously, exposure to sunlight is the best way for us to produce vitamin D naturally, right? Without supplementation. To make things a little bit more nuanced, darker skin is also something that can be a factor for vitamin D deficiency because higher melanin reduces vitamin D synthesis. Melanin acts as a filter for ultraviolet radiation. Therefore, people with darker skin need more sun exposure to make the same amount of vitamin D as people with lighter skin. And so therefore, the darker you are, the harder it is for your body to naturally produce vitamin D, even with exposure to the sun. Aging is also for vitamin D deficiency. And then if you are not getting enough vitamin D through your diet, that can also drive vitamin D deficiency. Although again, we don't get most of our vitamin D from our foods. We actually get it from exposure to sunlight. So it's not expected that you're going to meet your vitamin D needs from your diet alone. And that's why often people who have vitamin D deficiency require supplements for it. There are certain medical conditions that can also be a factor in vitamin D deficiency. So chronic conditions like obesity or kidney disease may impair vitamin D metabolism. And so that's also something to consider. And obviously from a nutritional standpoint, those are conditions that, dietitians can help with. Now, how prevalent is vitamin D deficiency? So globally, vitamin D deficiency affects over 1 billion people. So this is very common. And there's a higher prevalence in women with darker skin tones due to reduced synthesis of vitamin D from sunlight, as we discussed earlier. The health impact is vast. So vitamin D deficiency is linked to osteoporosis, weakened immune function, cardiovascular diseases, and even some cancers. And so that is why it's really important to address vitamin D deficiency as soon as you learn of it. So if you learn that, okay, you're deficient in vitamin D, do the best you can to increase those levels. Let's go back to exploring the connection between vitamin D deficiency and fibroids. So I talked about how there's some emerging research showing a connection there. And what we know is that studies show that women with fibroids often have lower serum vitamin D levels compared to those without fibroids. So that means when they go for blood work to assess, their vitamin D status, women with fibroids tend to have lower vitamin D levels according to their blood work compared to women who do not have fibroids. So that already was like a little hint to researchers to really look into this deeper. So we know that vitamin D may inhibit the growth of fibroid cells by regulating cellular proliferation and reducing inflammation. That means if you have enough vitamin D, it's actually protective against fibroid formation or growth. Another reason why, if you learn that you have vitamin D deficiency, it's important to get those vitamin D levels up, whether or not you have fibroids. So if you already have fibroids and you learn that you're vitamin D deficient, obviously you might be more driven to make sure that you up your vitamin D levels. Like you can do that through supplementation. We can talk about other methods as well. If you don't have fibroids, vitamin D deficiency is still concerning because it's linked to many different conditions. And so again, you want to make sure you're doing what you can to increase your vitamin D levels so that they're at healthy levels. A 2013 study actually found that vitamin D supplementation reduced the size of fibroids in animal models. And this was in the Journal of Fertility and Sterility. Now, again, it's animal models, it's not in humans, but it was pretty impressive that even after developing fibroids, when researchers gave these animals vitamin D, the vitamin D was able to shrink the fibroids a little bit. Again, this is in animal models. These aren't human clinical trials, but it gives us some insight as to the important role of vitamin D in treating fibroids and managing that condition. There are some ethnic and geographic factors to consider as well. So fibroids are more common and severe in Black women, as I've mentioned before. We tend to have higher rates of vitamin D deficiency due to our melanin and the effects it has on vitamin D synthesis. Again, people with darker skin have a harder time synthesizing vitamin D. And that's because when our skin is exposed to the sunlight, it triggers vitamin D synthesis in our bodies. And when you have darker skin and higher levels of melanin, that trigger is less sensitive and it becomes harder to produce that vitamin D. So given that there's research showing a link between vitamin D deficiency and fibroids, that may be a driving factor as to why Black women are more susceptible to developing fibroids. So if Black women have a harder time producing vitamin D due to darker skin and higher melanin levels, Black women are thereby more susceptible to developing fibroids. Now, again, this is correlation, not causation. So it's not to say that if you have low vitamin D levels, you're going to get fibroids, or if you're a Black woman, you're going to get fibroids. It's just your risk is higher. Now, there are hormonal factors at play too. So vitamin D plays a role in regulating estrogen, and a key driver of fibroid growth is estrogen. Another reason why you want to make sure your vitamin D levels are sufficient is because you want to make sure that there's optimal hormonal regulation, because vitamin D plays a role there too. What can we do to prevent and manage fibroids, right? We talked about vitamin D deficiency, the correlation there. Once you develop fibroids, the typical treatments are medical intervention related. So typical treatments include myomectomy, hysterectomy, or a uterine artery embolization. So there's some sort of surgical intervention or laparoscopic intervention at play. And that's like typically the way that you get rid of the fibroids, right? You take them out. From a nutritional standpoint, optimizing vitamin D levels is important, again, from a preventive standpoint. So you want to prevent the fibroids from developing, but if they've already developed, you still want to optimize your vitamin D levels so they don't continue to grow. So sunlight exposure is one way that you can do that, right? Because most of our vitamin D comes from exposure to the sunlight. So 10 to 30 minutes of midday sun several times per week can help with that. Now, I'm sure, as I talk about this, a thought that may come to mind is, what about the risk for skin cancer? And how do we mitigate, the risk of fibroid growth with the risk of skin cancer if we are trying to optimize our vitamin D level, right? And that's a really great question. And that's why you don't want to necessarily bake in the sun all day long, especially in the summer or times when the sun is very strong or the UV rays are very strong. But some exposure can be helpful, right? The sun is not this big, mighty bad thing. Some exposure is helpful. And so with women with darker skin, 10 to 30 minutes per day is one way you can get in. Now, if you live in the Northern Hemisphere like I do, at the time I'm recording this, it's February, you may not want to be outside so much. It's cold and it's uncomfortable. But remember, sun exposure doesn't necessarily mean that you're tanning in a bikini. It could just mean your face being exposed to the sun for 10 to 30 minutes a day, your, arms or your hands being, exposed. It doesn't mean that, you have to go to the park and lay out, with half your clothes off in order to get adequate sun exposure. The UV rays in the winter are also they're not optimal for producing vitamin D. And so you may need a little bit more exposure, time outdoors to get the same vitamin D levels you would during the summer. But again, it's not the most comfortable thing if you live in the Northern Hemisphere to do that during the winter. So it is a balancing act. And I'm going to be honest with the next recommendation that tends to be promoted amongst clinicians to their patients who have vitamin D deficiency, which is supplementation, right? So if you cannot get enough sun exposure at optimal times of the day, at midday, in the winter, you live in the Northern Hemisphere, it's just not going to happen for you to get 10 to 30 minutes midday sun exposure in the middle of February. One thing that you might want to do then is to supplement. If you ran some blood work, if your doctor ran some blood work for you and it was determined that, yes, you're indeed vitamin D deficient, and again, it's winter, you're not trying to be outside. One thing that you can do is to take a supplement. That's kind of the easiest way to go about this. There are multiple different types of vitamin D supplements, but there are two types of vitamin D specifically. So when I say multiple types of supplements, some supplements are multivitamins or have vitamin D and calcium, whatever. But in general, for the vitamin D component itself, there are two forms we have out there. There's vitamin D3 and there's vitamin D2. So vitamin D3 is derived from animal sources of vitamin D, and our body is able to metabolize vitamin D3 more efficiently than vitamin D2. So the first type of supplement or the preferable one in the dietetics and the medical community is usually vitamin D3 to recommend to patients who have vitamin D deficiency. Why? Because vitamin D3 is better absorbed in our bodies. It's the animal source of vitamin D. However, if you are vegan or vegetarian or you have some other contraindication to taking a vitamin D3, then vitamin D2 is also recommended. And that's going to be a plant-based source of vitamin D. Either way, if you are vitamin D deficient, you're not able to get adequate sunlight, or even when you do get adequate sunlight, your body is just not producing vitamin D at sufficient levels. Supplementation is going to be your best way to increase your blood levels of vitamin D. There are also dietary sources. So you can get vitamin D from your food, but it's not typically easy to meet all your vitamin D needs from food alone because there aren't that many food sources of vitamin D. The best sources, however, are fatty fish, so like salmon and mackerel, and it's best if you eat some of the skin or flesh of the fish that's closest to the skin. Egg yolks and fortified foods. So fortified foods are foods where vitamin D is added to the food. And those are the optimal food sources. Now, I mentioned eating the skin of the fish. So I want to say two things about that. So the first thing is why the skin of the fish. As you know, in humans, right, we are able to produce vitamin D when our skin is exposed to the sunlight. It's the same thing with many animals in the atmosphere, okay, in our environments. And so the skin is where you're going to find most of the vitamin D in fatty fish. However, my second point is that not everyone can digest the skin very well. So if you have certain conditions like irritable bowel syndrome, for instance. A lot of my clients and patients, and I'm going to be very transparent myself, I have some gut health issues. Metabolizing the skin of the fish can be very hard. It can be painful, like it can lead to stomach aches and stuff like that. And so if you just can't tolerate it, don't worry. You can still get some vitamin D from eating the flesh of the fish. It's, you don't have to eat the skin. You might want to eat the fatty part of the fish that's closest to the skin, but don't worry if you can't you can't digest the skin. It's fine. It's not toxic, but some folks just have a harder time digesting it, particularly if they have certain GI conditions, gastrointestinal conditions. With all of these things, all of these sources of vitamin D, whether it's exposure to the sunlight, whether it's supplements, whether it's getting it from food sources, the recommended intake is going to vary by age, sex, and other risk factors, like other medical conditions you may have. And so it's really important to work with a registered dietitian like myself to really figure out what is the recommendation for you. Like, what is the optimal amount that you need to achieve sufficient vitamin D levels. Now, again, that's where the role of healthcare providers is so key, especially for women with fibroids. You want to make sure that your healthcare providers are screening for vitamin D deficiency. And it's best that there's some collaboration with dietitians, gynecologists, and primary care physicians for like holistic care, so that we're considering everything and making sure that you're managing your condition as best as possible. Now, there are some myths and misconceptions when it comes to vitamin D and fibroids. So one of those is that taking vitamin D supplements will cure fibroids. It is not a cure. It's there to help manage growth. So if you already have the fibroids and you take vitamin D supplementation, the hope and the science suggests that by taking the vitamin D supplement, it will stop or at least slow down the growth of the fibroid, but it won't remove it. Again, I talked about typical medical interventions for fibroids, and that's surgical, largely. If you want to get rid of your fibroid, you gotta surgically remove it, whether that's like a bigger surgery or a laparoscopic one. You got to remove it surgically. Taking a vitamin D supplement is not going to cure your fibroid, but it may slow down its growth. Sun exposure alone is enough for everyone. That's another myth I hear. Like, as long as you get your sun exposure, it's enough. As I discussed earlier, it's not enough for everyone. If you have darker skin tone, if you live in the northern hemisphere where the UVB rays are not optimal during that time of year, and then to get the same amount of vitamin D synthesis in the winter as you do in the summer, you would have to stay outdoors for much, much longer, which is not comfortable. So exposing yourself to the sun is probably just not going to do it, in the winter in the northern hemisphere. You're going to need some extra support to get optimal vitamin D levels. So sun exposure alone is not enough for everyone, okay? And I just want to make sure that's clear, because even though, yes, we get most of our vitamin D from exposure to the sun, it's not always possible for all of us to get the optimal levels of vitamin D. So supplementation, changing your diet, those are things that you can do to combat the fact that you may not be able to get sufficient sun exposure for sufficient vitamin D synthesis. Another myth or misconception that I hear is that vitamin D is only important for bone health. I mentioned at the very beginning of this episode that vitamin D is important for so many things beyond bone health. Yes, bone health is important, but vitamin D also affects numerous systems, including our reproductive health. And so again, that's where we may also see the connection between vitamin D and fibroids. And so it's really important that you're achieving optimal vitamin D levels, so that way you are optimizing your health from many different standpoints, both reproductively and in terms of like your bone health. Now, some closing thoughts I have is that this research is still growing, the research between vitamin D deficiency and fibroids. So we're still learning about it and still trying to understand, like, what is the optimal amount of vitamin D to really prevent this condition, to really prevent fibroids, or even to really reduce the growth of fibroids significantly to the point where maybe someone feels like they don't need the surgery because the fibroid's not bothering them anymore. And with that said, we do know that there are ways right now that are accessible and practical to optimize our vitamin D levels. So whether that's taking supplements, whether that's, eating more fatty fish, there are ways that we can optimize our vitamin D level while this research is growing. And so I really want to encourage all of you to speak with your healthcare providers to see, what is your vitamin D status? Are you vitamin D deficient? If so, what is your risk factor for developing fibroids as well? If you have a family history of this and you want to understand what your risk is, that's important to discuss with your healthcare provider. And especially if you're someone who is both vitamin D deficient and already has developed fibroids, it's important to discuss your treatment options with your healthcare providers. And as a registered dietitian, I can help you determine what is the optimal level of vitamin D supplementation, or we can work together to adjust your diet and come up with a diet plan that works for you to optimize your vitamin D levels. We can also talk about lifestyle factors and getting outdoors and doing certain activities outdoors at optimal times so that you get that vitamin D synthesis naturally as well. So I want to invite you guys to share your experience. Let me know if this was helpful. Comment, subscribe, and get this message out there. I love talking about this, and I would love to continue talking about the role of nutrition and women's health conditions. I think it's so important, not spoken about enough. I also suggest that you schedule a blood test for your vitamin D levels as part of your routine healthcare every year. You go for that physical, ask for your vitamin D status. And if you want to know where to go from there, you find out you're deficient, come to me. I can help you. You can set up a session with me. I'll link it below, and we can talk about what you can do to increase your vitamin D levels. I accept all major health insurance plans, so don't worry about, the out-of-pocket costs. We can talk about that. We can negotiate something, but it really is important that we understand how nutritional deficiencies can really be driving so many different chronic health conditions. And next week, I really want to talk about the impact of, or maybe not next week, but our next episode, whenever that comes out, I want to talk about the impact of hormonal balance on our overall wellness. And, I'm so excited about that. So thank you so much for your time, for your support. Again, comment, subscribe, support this channel, and let's just keep going with these topics. Thank you for being here. Bye.